Thank you, Dr. Cohen. As you can see, while our numbers are mostly stable, we have more work to do to beat back this pandemic. Last week, I outlined some of the state's priorities in our COVID-19 response for this summer. And as I said, we anticipate lifting mandatory capacity, mass gathering, and social distancing restrictions by June 1st. As Dr. Cohen said, we hope to go even further when we get at least 2/3 of adults vaccinated with at least one dose. Once we get there, and if our trends are stable, we plan to lift the mask mandate completely. Let's work hard in May and get as many people vaccinated as we can before summer gets here. So now for this executive order. Today, I'm announcing that North Carolina will cautiously ease some restrictions starting Friday, April the 30th. Masks will no longer be required outdoors, and mass gathering limits will increase to 100 people indoors and 200 outdoors. Masks will continue to be required indoors, in public places, since this virus still can spread easily when we're inside. Even though we're continuing our dimmer switch approach of easing restrictions, we need to stay vigilant. In addition to indoor masks, many of our strong safety requirements remain in place for public places in May, including social distancing and capacity limits, which continue to be important. Following these protocols, along with getting vaccinated, will get us through this and will lead to easing even more restrictions on June the 1st. But the critical piece of our success is getting vaccinated. We have safe and effective vaccines available for every adult in the state at no cost. They're easy to find, so many different locations. They're convenient appointments and walk-in opportunities. Right now, about half of our adults, as Dr. Cohen said, are partially vaccinated, and almost 40% are fully vaccinated. That's great progress. But to get to 2/3, we need everybody to work on this. Tell your loved ones why it's safe and easy. Give them a ride if they need it. Go get vaccinated yourself if you haven't already. And as Dr. Cohen said, you can find more information at yourspot.yourshot.nc.gov. We've already shown that North Carolinians are made of tough stuff. Together, we're going to get through this. Also with me today is Director of Emergency Management Mike Sprayberry. Monica McGee and Brian Tipton are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media, and we'll take the first one. If you can identify yourself, please, we'd appreciate it. Question, because we know it's critical. One incentive you just heard us mention that, today for the next order, beginning April 30th, we are lifting the mandate on outside masks. And if we can get to 2/3 of our adult population at least partially vaccinated, we plan to lift the indoor mask mandate. So that is a real incentive. We're also talking about other things with local groups, and a strong campaign is starting, and I might let Dr. Cohen tell you a little bit more about some of the things we're doing to try to get people to get vaccinated.
Thanks for that question, Caroline. And I hope first and foremost that folks go and get vaccinated, because we know these vaccines protect you, your family, and your community from getting COVID. And unfortunately, we have seen that COVID can be deadly here in our state and around the world. And so we hope that in and of itself is an incentive. But we know we need to make this easy for folks. So one of the things we're focusing on is to make sure that we have access to vaccine in all places across North Carolina. So we're making sure we're having even more places where folks can go can go walk in and just get their vaccine. Hopefully, maybe they're at Walmart or at Harris Teeter or Publix. They're shopping already, and they can get their vaccine that same day. So we're trying to make things easy. But then we also want to make sure that folks are hearing from their friends, their family, from their trusted community members. That's why we launched the Bringing Summer Back campaign. We really encourage businesses and organizations to join us in this campaign. We're going to have 2 weeks in May and 2 weeks in June where we really focus on really talking to others about the importance of vaccinations. And I'd encourage you to call your doctor and your other healthcare professional from where you get your medical advice. Talk to them about the vaccine. Ask them questions that if you have any concerns, and hopefully just get a vaccine from them right in their office. We're really working with all of our primary care practices across the state and really appreciate all of the work our vaccine providers are doing to make things easy, to answer questions, and make sure folks know that we want them to get vaccinated as quickly as possible. Thanks.